It's great to be with you, Chip. I always enjoy being with you. We've known each other a long time, from the time you were Chief of Staff for Ted Cruz to when you worked in the think tank world, and really look forward to this conversation with you.
Well, I'm glad to be here with you, Gary, and all of your work and your life's dedication to policy. And when I was at TPPF and you were in Alabama, it's great to be here now together in Congress working on policy.
Well, I want to talk with you today about a bill you've introduced that deals with health savings accounts. I think it is one of the keys, if not the key, to getting our healthcare system not only functional and expanding the number of people who have access to healthcare, but also getting the cost down while improving outcomes.
One of the reasons I ran for Congress now, 4 years ago, was because of my experience in the healthcare system. And I was very blessed to have a policy where I was able to go to MD Anderson and get treatment for cancer. But at the same time, I kind of observed a lot of the hiccups along the way and how important it is to be able to go get good health care. And I think we've often got trapped in sort of the coverage conversation. And let's fast forward to a second. I'm now in the United States Congress, and under the Obamacare plan that I would have here in Congress, I can't go to MD Anderson. And so think about that. That's where we are. We've got coverage.
That's the plan I'm under, by the way.
Right. And I can't go get care. So what's the point? Meanwhile, people say, well, we've got this, you got this free market system. It doesn't work. Hold on a second. We don't have a free market system, right? We have insurance-run, government-funded healthcare, where large insurance companies are making money hand over fist, upwards of 60, 70, in one case, I think Humana, 89% of the revenue from government contracts. About half of the entire spending is from government contracts. So now bring that back, and now the individual family is getting stuck. They're spending on average $22,000 by the time they pay what they pay and what their employers pay for a family of four for their insurance coverage, and then they have a $7,500 deductible. That's not healthcare. We want to empower consumers, right? And that's the goal behind the Personalized Care Act, HR 725, where we're able to go empower consumers with massively expanded health savings accounts so they can go buy the insurance, the health care, the direct primary care of their choice. And we want to empower them rather than having to go check a box with a government insurance bureaucrat to get health care.
One of the things I try to point out to people is that you're paying premiums. If you're going to have health insurance, you're going to pay premiums, and your employer may pay part of it. But if we set up health savings accounts where your premiums, instead of paying premiums, you're putting in a health savings account with pre-tax dollars.
Right.
It not only allows you to build up an amount of money that you can use to cover your health care needs, but it will also reduce the administrative cost of healthcare. But that, and you kind of touched on it, but that's a key point of this, is it restores the physician-patient relationship. They're making decisions based on what's best for the patient, not what an insurance company will cover.
Right. And that's exactly the point. And we've got all sorts of great companies in Austin. I know you've got them in Alabama. We've got them across the country that are trying to crack through and offer alternatives so that individuals can go directly to get care. What I think the American people have lost is we ended up with a system that just through kind of timing and chance after World War II with wage controls and things, you have basically an employer-centered system where you've got insurance companies deciding what your care is along with employers. And it's fine for our employers to provide health care dollars, but I want to equalize that treatment. Right now what we've got is a tax advantage for employers to provide health care. But if you're on your own or an individual, or if you want to change jobs, you ought to be able to take your health insurance with you, just like you do your auto insurance, your life insurance, homeowners insurance. Like, I don't worry about that if I lose my job. But if I change jobs, I'm going, uh-oh, what's my health insurance? That's silly. This is America. Let's free that up and let an actual market work, but more importantly, empower patients and consumers.